Okay, good
That's
evening,
good to
You're
everyone.
looking better. Your
Yeah,
face is looking better.
that's for sure, but the doctor keeps saying it's something else and something else. So
Oh my God.
You look good, Shelley.
I'm gonna be okay.
You will be.
Let's start.
So good evening, everyone. Gonna start our March meeting for the Health and Human Services Committee of Community Board 7. May I have a motion to adopt the agenda? All right, agenda is adopted. Very first thing that we're gonna do is have a presentation from Kay here from Doros. Kay, take it away.
Great, okay,
Try to share your screen. We may have some technical reconfiguring to do.
okay, yeah, let me get my bearings here.
There we go.
Okay. and then let me this, and this. Okay, great. Perfect. I'm hoping everyone can hear me if you're over Zoom. Hello to friends over here in the little audience section. Just want to make sure you can see and hear me if needed, but these slides should be quite helpful. Okay, great. So thank you so much, Isaac. As was mentioned, my name is Kay. Hi, come on in. I am the outreach specialist at DeRote. DeRote's a nonprofit, actually just a stone's throw away from where we are, right on 85th Street. And part of our role as outreach specialist is to talk with community members that DeRote is here, we exist. We have a bunch of great programming that you can get involved with sort of one way or the other. And we also take referrals. So if you're like, this is great for my neighbor so-and-so, 100% we can accept those as well. So come on now. There we go. A little bit of what we're going to go over in the 20 minutes we have together is who we are. We focus on social connection. So why is that important? Why do we focus on that? And our programs. So we're going to really give you a head to toe look at our programs and some data from what that looks like within Community Board 7. So DeRote, I'm sure some of us have heard of it. Can I see a show of hands who've heard of DeRote? Exactly from this side of the room. Excellent, amazing. Okay, great. So for those of you who don't know, DeRote means generations in Hebrew. I get a lot of questions of what does the acronym stand for? It is not an acronym, it's that Hebrew word for generations. So the reason why we use that word is we put together folks of different age brackets all the time with our multiplicity of programs. As you can see from this photo, we have high school students work with older adults, which in our case means 60 and above. This year is actually our 50th year in operation. So if you sign up for our newsletters via our website, you'll probably see some bells and whistles for that milestone. But our focus is social connections for our older adult neighbors. That's what we've been focused on for the last 50 years via programs like in-person programs there at the building just around the corner, programs on the phone, programs over Zoom, and programs in-home, which means we send volunteers directly to the homes of older adults to do a multiplicity of activities, which I'll review with you now. So here's what that looks like in terms of numbers. So I'm talking about fiscal year 25, which is the same sort of 12 months, just in a different start and end point from June to July. And we supported 6,697 older adults who participated around 90,000 times. I think this pie chart's really helpful because you can see most of the people we support dial in. We work with people from all over the country. We even have people dialing in from London, from Israel, from really all across the country, which was sort of the silver lining of beginning Zoom programming in 2020 for reasons you probably are aware of, which is kind of exciting that we have a whole department now dedicated to Zoom programs where we didn't just 6 years ago. But of course, that in-person little blue bracket over there, everyone in Community Board 7 who's over 60 is eligible for in-person programs. So definitely really important that you know what they are. So DeRote really runs on a volunteer model. We would not be able to have the far-reaching support that we do without folks who come out and say, I want to help my neighbors. And that looks like this. We had a little over 8,000 volunteers volunteer for about 50,000 hours of service. Same with volunteering. We do have people volunteer from home, over Zoom or over the phone. We have people volunteer in our office, and as well as volunteers go out to the east and west side, as well as Westchester, to help support neighbors. And we actually do have volunteers also come from all over. I'm thinking in particular, one volunteer lives on Long Island, but he comes into the city often and figures, oh, after work, I'll do some volunteering and then take the Long Island Railroad home. So it actually kind of works out for his life and schedule. So we do get that as well. If people are willing to travel, they can absolutely come travel and support this area of the city. So what does that look like in particular in New York City, if you're curious? This is what we call our catchment area. So that means if older adults, individuals who are 60 and above, live within these maps, they are eligible for in-home programs. Anyone can come to DeRote. We've had people from Queens take the Access-a-Ride out to our office for those in-person programs. But if we come to you, it looks like this. So on the west side, that's 59th to 125th. And on the east side, that's 14th to 96th. So that means everything really falls into the catchment area within Community Board 7. This is just a map that I pulled from the Community Board 7 website. So I'm going to go now into what those programs look like. I mentioned in-home, I mentioned in-person, but what are those programs actually? But I'll pause there just in case there's any questions from you all. Anything over Zoom or in the chat? Maybe happy with that. Let's see. Okay, great. While you're checking, I'll go into Friendly. Yes, go ahead.
In terms of funding, I was an original funder through the
Okay.
area policy boards and so on to get it started. So, and then it started having fundraisers. So what money comes from elected officials and what comes from voluntary donations? Do you know that? No.
Yeah, I know to a degree. So we have a multitude of funding because we're a nonprofit. And I didn't mention this, but everything I'm going to tell you about is absolutely of no cost to the older adults that receive these services. And of course, if you're volunteering, the word implies that you're not getting paid, but we also don't require you to pay to do it, right? So yes, we are funded like a lot of other nonprofits. A lot of our funding comes from private foundations. Some of them are Jewish foundations, some are not. We are proudly a Jewish organization, though we serve everyone. We also, to your point, have city council funding. We are not federally funded, but we have some state funding and some city council funding and individual donations as well. People in the neighborhood are really kind enough to give to DeRote, and that's why we've had our longevity. We really are very thankful for all of our funders to keep us going.
Yeah.
As far as a breakdown, there is one on our website, and I'm sure I can find a more detailed one and send it over if you're curious. Okay, great. Friendly visiting. Have we heard of this one? Great, I'm
It's
seeing
the
some
original.
I love that. Yes, exactly. That's usually what I tell folks as well.
Okay.
If you know about DeRote, you probably know about Friendly Visiting.
Right.
So this is Adam and Sharon. They're a real Friendly Visiting match on the Upper West. This program visits, volunteers rather, visit in the home of older adults to build new friendships. We make matches based on who we think might get along, who signs up for the program on either end, and they visit each other, or rather the volunteer visits them.
So can I,
Yes, please.
what's the criteria for a person in his or her home being attractive to this attracted to this program? I
Yeah,
mean, are they people who are loners or they have no other life or they just old, or what?
yeah. So question was, what might attract someone to have a volunteer come to their home?
Yeah,
Some older adults we would consider a social work term more home-based, whether that be because of a medical need or a preference or just a sort of lifestyle choice. Really a majority of folks come to us who need to be at home for one reason or another.
all the time.
So most of the time, yeah, home-based implies that that's sort of where they need to be based or want to be based or all those other reasons. So it essentially is getting rid of a barrier. If we can get rid of the barrier of taking the bus or of maybe even some shyness, just having one person go over, that's great. And that way they can get that really life affirming and saving social connection. That's what we do best. So even this idea of like making a new friend, finding someone to connect with, even building a relationship, all of that starts with the human need that is human connection. We also have folks who do go out a lot and would consider, you use the word loner, but might consider themselves incredibly social, but are like, you know, I'd really like to spend some time at home. I'd like someone to visit me. If you're getting up there in age, our average age, I believe, is 80. So it stands to reason that they might want some of those programs go to them. And that's what we have available. So there's an incredible amount of matches in Community Board 7, 114. Here's a breakdown of zip code of what that looks like. Folks friendly visiting, you can either select the monthly option where a volunteer will attend monthly with their match or weekly. So that's a bigger commitment. Every commitment is a full year. We ask both parties to agree to that full year so they can really create that beautiful match. Every single, what we call a dyad, you might know this as a social worker, it's a fancy word for the two people in the match, are supported by a friendly visiting social worker. So that means all these relationships are very much scaffolded by our staff from a social work perspective, to make sure that the guidelines are being followed and that things are going well. And, you know, sometimes people need to be rematched. Oh, that didn't work out? No worries. We're gonna figure out a different path for you so you really feel supported and can do the program to the best of your ability. Okay, moving along to seasonal and holiday package deliveries. In this program, older adults receive a big purple bag that you see right there. We just had this on Sunday. If you saw in the neighborhood people carrying around bags, they'll receive a holiday themed package and a friendly visit. That visit can either be in home for an hour or the package will be dropped off and you'll enjoy a phone call later in the day. Both are great. We have this 5 times a year and it is essentially a one-time opportunity. So I recommend to people who say, I want to try to row it out, but I don't want to commit a year. That stands to reason. I recommend you just sign up for a package delivery. You'd come to our office, you'd get that name of that older adult and address, head to their home and see what it's like to connect for an hour. From your district in this past fiscal year, 404 older adults received packages 1,188 times. So there's a number difference because one older adult might have received all 5, one might have received just 1. It's up to them, it's up to their schedule. If they're out of town that day, maybe they don't sign up for the next package delivery, but they're certainly eligible for all 5. Response team, I'm a little biased because this one's my favorite and I'll tell you why. Response team is what we call request-based volunteer connections. So this one's a little bit different in that friendly visiting is more relationship-based. Package delivery is also, let's talk, let's connect. This one is more task-based, but of course, we still want that social connection embedded in the completion of the tasks. So things like, hey, can someone come over and play cards with me? Great, we'll send you someone right over. We have our birthday visit program housed in response team. Volunteers take those very quickly because it's a great way to spend the day. I can show you the freezer in our office. We keep these nice happy birthday cupcakes and we give you a card. We'll send you to someone's house for their birthday just to wish them a happy birthday. Delightful. We get a lot of requests for walking in the neighborhood. People love to walk, but maybe would like a companion or feel a little bit hesitant for one reason or another, or just want some company as they enjoy when the weather gets nice. We have blind or low vision individuals, sometimes have folks read the mail. And really much more, it's called response team because the volunteer is essentially responding to a bunch of requests and tasks via this sort of really cool board that one would get once they oriented. And it's kind of like a classified section in a newspaper. So in CB7, 187 older adults connected for 410 visits. So one could get a number of visits.
Are all of these people living alone or are some of them living with others?
Yeah, I would say, I think it's between 70 and 80% of older adults that we support do live alone, what we call solo agers, but not necessarily. So some folks might have a roommate, a partner, a domestic partner. Some folks have aides, medical aides in one way or another come in and out. Some folks don't. Although we support, a smaller area of New York City, there is so much diversity in need and in social connection among all our folks. But we like to tell people we're really all looking for the same thing, which is social connection. The idea of loneliness is very subjective, right? You probably have experienced this yourself. Be in a crowded room and not feel like you're really fitting in, feeling a bit lonely, or you could enjoy solitude and be like, this is great. Everyone has kind of a different threshold for how much they want to connect. So we want to meet folks where they're at in that regard. Really think about social connection as it's what you want out of it. Okay, tech coaching. This one is also more task-based. So we send volunteers directly to the homes of older adults for up to 8-week sessions where the older adult would pick what goals they have for their tech. Right, so I did tech coaching for a little bit and I helped an older woman decide which delivery apps would be best for her groceries. And as you can imagine, that took some conversation, some planning. What kind of store do you want to order from? What kind of quality do you want out of the food? How quick do you want it? How much do you want to spend? All of that's very helpful to have someone literally sit with you in person and chat it out and write out a pro and cons list. And really just keep things light. A lot of tech barriers I've found are emotional. People throw their hands up and they say, I can't do this. This was not designed for me or my age group. When in reality, you just need someone who's kind and like understands how to send email or use Zoom to sit with you and figure it out. So that's what this program is all about. We also do this program at our office where the older adult and the volunteer would just meet up at that central point of DeRote, which is handy because if you live outside of that area of support, you can still get tech coaching. You just have to come to us. Really great program. Oh, and you saw those numbers, yeah? 131 older adults participated 766 times. These numbers are big, but they could be bigger, so tell your friends. Okay, visit by DeRote social workers. So I mentioned earlier that we serve in-home in your area, right? But the first step to essentially unlocking all of the wonderful programs you just saw, and this is required, is that a DeRote social worker must conduct what we call a home assessment. So a social worker will take a time and day to go visit that older adult and do a biopsychosocial assessment, right? They're trained in understanding how humans work and operate and see if they're a good fit for our program or if, you know, the program is the right fit for them. But essentially, it's really just getting to know our client base. We want to go over and learn about the ecology of an individual's life, as opposed to they're signed up for tech coaching. What is their life like? Who are their friends? What do they want out of the program? Are there more services that they would like or be eligible for that we can refer them out to? Have they heard of DeRote before? What else are they looking out of the program and of life in New York City? And it's a really lovely opportunity to make sure that the home is good to go, to send a volunteer over, or how else they want to get involved in DeRote. Once an individual is home assessed, they're good to go for 2 years. So we just ask for a reassessment after 2 years of service. Yeah, please.
How frequently does the tech coach go? Is it regular or you need, on the basis of what you need them?
Yeah, so tech coaching, folks can take up to 8 weeks and then they can re-up. Oh, I liked working with so-and-so. Let me re-up 8 weeks with them if both parties are available. It runs all year. And what's great about our program model is that we'll match you with someone based on your shared availability. So if you say, I want to do tech coaching, you'll just have to answer some questions like, okay, do you have an iPhone, an Android? Is it a Kindle? Is it a tablet? What days are you free? Are you open to having all types of folks come visit? Would you rather a teen? Would you rather someone around your age bracket? And once all that paperwork's filled out, we match you with someone who, one, can answer all your tech questions, right? Not everyone who knows iPhone will know Android, et cetera, stuff like that. And if both works for you to come visit on Sunday mornings, great. We'll go ahead and make that cadence Sunday mornings. And if your schedule changes, you'll probably get a different tech coach. Yeah, question back here.
If a high schooler wanted to volunteer with DeRote, how would they do that?
We have plenty of opportunities for high schoolers to volunteer with DeRote, whether that be just chess on Monday afternoons here at our office or full internships. So we have them in the summer, winter, and spring, and all those details can be on our website, but we'd love to have you. Okay, great. I want to make sure I'm keeping time. How am I on time?
About 5 more minutes.
Thank you, 5. Okay, lifelong learning. So I mentioned we have programs in the office, right? So that's 171 West 85th Street. And this is a plethora of things. You'll see a photo here of people sitting in a circle doing, I think, what is a meditation. But we have concerts, lectures, movie screenings, art classes, walking groups, knitting groups. We have programs all through Monday through Friday. So that's all on our website. We just ask that folks pre-register and be over 60. That is the only barriers to entry. We also have, as I mentioned, a bunch of Zoom programs. So you can tell folks who maybe don't live in the city if they want to check these out. You can see in this photo, if you can see it, someone holding up maybe like an origami piece to the camera. I think it exemplifies what we want out of the Zoom programs. It's not a lecture on YouTube that you can put on in the background while you fold your laundry. It's interactive. Go in the breakout group. What are you thinking in the chat? We're going to put these people together. Put up your art to the camera. The idea is social connection. So we want just that, even if it's over Zoom. with about 30 programs a week. Okay, getting to the home stretch here. What's this? Okay, phone programs. So we have one phone program called University Without Walls, which is essentially classes over the phone. This is our longest running program. 64 folks connected over 1,000 times to our variety of classes that are available over the phone, including landlines. We also have a program called Caring Calls, which is kind of like friendly visiting, but the phone version. So volunteers are matched with older adults and they connect for 8 weeks for 30-minute phone calls. And we do have volunteers and older adults dial in from outside of New York. So I do know of a match. The volunteer lives in Denver. The older adult lives in New York City. And I think it's just they're just so pleased as punch to be like, wow, I would have never met or talked to someone from Denver, and now we're buddies and we chat on the phone weekly. Okay, great. So here's what participation from just this past year looks like for Community Board 7. As you can see, a very little bit is in 10069. And technically the zip code for DeRoot is 10024. So that's why it's that nice big orange slice. And here's how to get in touch with us. I'll make sure that these slides are sent out. You can call us and say, hi, I'm so-and-so. I heard Kay's presentation. I'd like to sign up for a response team to help me with my grocery shopping or whatever the case, and we'll take it from there. You can also email us, and I really recommend signing up for our weekly newsletter on Sundays. You'll get the roundup of what's coming up this week, and you can register for classes that sell out pretty quickly before anyone else sees it. With the time left, I'd love to answer any more questions you have, and thank you so much. Yeah.
So how do people like the person in Colorado learn about Duro, and how do they get in contact with you? I
Yeah,
mean, it's a big,
right?
this,
Absolutely, yeah. If folks look up or Google, how do I volunteer from home? How do I volunteer over the phone or on Zoom? We try to optimize our search engine optimization. That DeRoot will pop up on that Google search. There are other programs like Caring Calls in the country, and we actually get referrals as well. So for example, AARP has essentially a Caring Calls program, but it closed. So we got a bunch of calls this week of, hey, I got referred here because I used to do a program very similarly and I'd like to continue, but this one has shut down. So it's a mix of things. It's our marketing team, it's other nonprofits referring to us, and it's volunteers from all over finding ways to get in touch with us remotely. We'll try to make our presence known. Yeah, please.
Sorry to ask this question, but it's very prevalent in our society. How do you protect against elders being exploited? And has it ever
oh, that's a
happened?
good question.
It is a good question. Yeah. Elders being exploited. Has that ever happened? Not to my knowledge. Has that happened? We have a background check for anyone who wants to volunteer with us. So we do a background check that is done with New York Cares as well. If you've ever volunteered through there, it's a much bigger umbrella of volunteering in New York City. We also require references and sort of short paragraphs about, okay, why do you want to do this program? We also really rely on feedback. So as much as we're talking to the volunteer saying, hey, did everything go okay? Like nothing, made you uncomfortable or how are you feeling with your match? We try to ask those questions. And same on the other side. How are things going with that volunteer? Did you like when they visited? Everything went okay? Did they say anything that might have pricked up some ears? That's also why we assign social workers to those matches to check in sort of with each individual on a private way. And that individual can manage if anything seems fishy. Luckily, people are incredibly kind and go above and beyond. I'm really very impressed by our volunteer cohort. But to your point, like these things happen all the time. So of course, like we have practices in place to keep everybody safe.
So I think we have time for one more question.
Love it.
Anyone has, or if anyone has on the Zoom as well, feel free to raise your hand and we promote you to panelist. If not, Kate, thank you so much for your time.
I just want to remind everybody that Kay is part of our senior task force.
That's right.
And before Kay, DeRoot has been a member of the task force since we started in 2018.
Yeah. That's part of my role as outreach specialist, is having a presence frequently to make sure that people know we're around and that we're free and that you should refer your friends to us. Yes, go ahead.
Is there any kind of council nonprofits like yours and others in this district? Where you
There
touch
is
base with each
the-
other besides through the task force?
The Uptown Interagency Council, the UIC, has many different members, and that's Uptown Manhattan. We meet monthly. I can send you some more information if you want.
No, that's
Perfect.
good,
It's
thank you.
coming your way. Okay, great.
Well, thank you so much, Kate, and don't feel like we're kicking you out or anything, you're more than welcome to
You know, I
stay,
actually have an
but.
event tomorrow, so I'm just gonna run over.
That
and
sounds
for
good.
it.
Alrighty, so moving on to our agenda, updates from the new administration. We have a new deputy mayor for Health and Human Services, Dr. Helen Arteaga, and a new commissioner of Department of Homeless Services, Erin Dalton. Dr. Arteaga brings many, many years of experience to Health and Human Services. She served most recently as the CEO of New York City Health and Hospitals in Elmhurst, and she led the hospital through COVID. She secured about $140 million for a capital campaign for Elmhurst Hospital, and she has a PhD from the CUNY School of Public Health. So a very, very impressive person. I'm actually going to be meeting with her on April 22nd at my place of work. And Erin Dalton comes to lead the New York City Department of Social Services after serving as the Commissioner of Social Services for Allegheny County in Pennsylvania, where she led initiatives that helped reduce street homelessness by 98%. And she really built a national reputation for using data-driven decision making. So very exciting that she'll be joining Department of Social Services, overseeing HRA and the Department of Homeless Services.
She was at Gail Brewer's town hall.
Oh, she was.
Last night. And Gail grilled her a little bit on a homeless encampment, I think 74th Street and Broadway, something like that.
Near that hotel that's being renovated.
Okay.
That was-
I'm not familiar with it. In Hammond, apparently Gail's gotten a lot of complaints. So,
Oh, we'll give her a little bit of time.
yeah. That's
Commissioner
what she was asking for. She said, I'm from Pittsburgh. I just got here.
But she brings a great
Yeah.
reputation, so there's a lot to be hopeful for on that end. So other big news in the homeless service space, on March 5th, the Mamdani administration announced that it was closing the main intake center for men, or relocating rather, the main intake center for men and for adult families without children under the age of 21, also known as AFIC. Historically, both of those intake centers were on 30th Street, adjacent to Bellevue. And starting on May 1st, single adult men will be directed to 8 East 3rd Street in the Bowery, and adult families will go to 333 Bowery, which is actually just right around the corner from the single adult men intake. There was also a temporary shelter at 30th Street for 250 men, and the move out just concluded a couple of days ago. After the closure, some staff will still remain at the 30th Street location to redirect people to the new intake centers. Intake for single adult men and for adult families without children has been at 30th Street for the last several decades. So this is a very big change, and it may yet still relocate once renovations are done for the building.
Is that what they're doing, renovating
They're renovating it.
for the same?
I
type of
think that's to
service?
be determined. I may be misspeaking there, but I think it's to be determined.
That's what I heard.
So an update on the Hope count. So on March 10th, there was the homeless outreach population estimate, also known as Hope, which is a mandatory point in time count from the Department of Housing and Urban Development from the federal government. And this was rescheduled twice due to the snowstorms that we had in late January and in February. And about 1,300 volunteers participated and about 240 outreach workers supported that. In 2025, about 4,500 people were counted to be living on the streets of 5 boroughs. And we're expecting those numbers to increase when we get the report from Hope in June or July.
Is that only on the street or also?
That is
in-
only on the street and subways.
In subways, that's
Yeah,
it.
unsheltered homelessness.
Sheltered.
So more news on homelessness. Last week, New York State Comptroller Thomas DiNapoli reported that the Department of Homeless Services street homeless spending has tripled in the last several years. It's gone up from about 102 million in fiscal year 2019, which is July 2018 to the end of June 2019, to an estimated 456 million in fiscal year 26. So it's practically tripled. And even though that's the case, the city has still experienced a marked uptick in street homelessness, up from about 3,600 in fiscal year 2019 to 4,500 in fiscal year 2025. So when you do the math, it's about $81,000 per person. And with that said, New York City still does an exceptionally good job on sheltering people experiencing homelessness. Since COVID, homelessness in the city, or the shelter census, has gone up 78%, up to 140,000 individuals approximately, but only 3% of that population is unsheltered. So in other words, the city is sheltering 97% of everyone in the city that is experiencing homelessness. And that's the second lowest of all major municipalities in the United States. So lots of work to do. The comptroller said that we need to focus on the solutions that are working, and that the increase is largely just due to, or the increase in spending is due largely to the increase in the number of people that are unsheltered.
But that are unsheltered, sorry?
That are unsheltered.
Didn't the number of people in shelters go down recently because of the migrant heart
Yes.
crisis this past?
Yes, indeed. The mayor closed some of the emergency shelters that were operating and sheltering migrants now that that crisis has subsided. Some hyper local stuff. There's the redevelopment of the St. Agnes residence on 74th Street. This is just in the proposal phase. But we have yielded a number of complaints or a number of concerns rather, from current residents of St. Agnes, as well as neighbors on 74th Street about this prospective redevelopment. I believe there are about 150 people that currently reside in that residence, and the proposed plan would see the total renovation of the building for the creation of 50 new units of supportive housing. So people are concerned that the existing residents would be displaced,
Yeah.
and that there would be an overconcentration of supportive services on 74th Street, because there is a shelter at the old Calhoun School over there. So obviously, we're very concerned. We don't want anyone to become homeless and lose their housing in the creation of supportive housing. So we're gathering more details, hearing from the Sisters of Charity Housing Development Corporation directly, and seeing if they could answer some of the questions that community members have raised. Yes, Harry.
Are you working with SEMA? I mean,
Yeah.
okay, because they're the housing
Mhm.
committee. is
Yeah, Seema and I were on a call on Friday,
Okay,
and
and it seems that I recall, and I may be recalling this different, wrongly. But the 50 new units is less than the current.
Correct.
It's a
Which
lot
is
less.
really great that we're reducing the number of.
What is the unit at now?
Originally, we
I
were,
believe it's about 150.
we were
Oh, so it's
originally
different.
said it was gonna be such a large number for such a small space.
Mhm,
So when it came before the committee board a few years ago,
mhm.
there was tremendous concern that it was by the committee, there was just too many people in that space.
Yeah.
Okay, do we know the demographics? Because I remember hearing,
It was too many for that space.
I remember hearing that
50 is.
nuns were living there and they were getting older.
Yeah.
And that, no one ever talked about 145, 150 people.
Mhm.
You know, when we had the land use and housing.
Mhm.
They talked about nuns, they're growing older and they, you know,
Yeah,
and that now they're gonna do something good for the community. Now here of 140, is 145.
It's a lot of old school SROs. I
Okay.
actually have a client that resides in that building.
People who live there, and so it's not a group of aging nuns.
Mhm.
No, that's what they said.
Yeah, that's what they said, and it said, okay, so this 15, 20 aging nuns, they'll find good places for them. This is scary, you know,
Yeah.
that we was presented that way,
My
Yeah.
understanding is that there are lots
in a
of,
deceptive way.
And I knew that 50 was a reduction, but I didn't know it was that dramatic.
Mhm.
reduction.
my
I mean, they
understanding
didn't-
is that there are lots of people that have lived in this building for a long time, as well as a lot of young people that are in local dance academies.
Mhm.
Which is an interesting demographic to be in, you know, to be concentrated in one particular
Right.
area, but nonetheless, a lot of people might be displaced from this, so we gotta keep our eyes out.
Sorry, weren't we thinking about SROs being one of the things we spent money on
Mhm.
surveying and supporting?
Mhm.
That SROs are a good thing, that the
Mhm.
community
Yeah.
board is talking to have more of, and then this is gonna be taking.
Well, the problem is there are a
Taking
lot
it
of
out?
buildings that are listed for SROs that are operating as illegal whatevers.
Is that
Are
what,
they
is
illegal?
that what St. Agnes
No,
residents?
no,
is?
St. Agnes was not. But there are a lot of buildings on the Upper West Side that could be converted to SROs with TH funding. I would suggest a joint meeting with with housing.
Mhm.
You need some planning, take a couple months, but and I'll send around the report, but
Mhm.
they're talking about they were comparing what they think is needed, and what the city budget is for housing vouchers.
Mhm.
So you have section 9, section 8, and then what, I forget what the city's one is called.
City Steps.
Yeah, and the difference was like 5 billion, $4 or $5 billion.
Mhm.
So it means a lot of people are going, if the state and city can't cover what the federal is going to take away, it means a lot of people are gonna lose housing.
Yeah.
And so we should be looking at specifically on the Upper West Side.
Absolutely.
Can I just ask real quick, Isaac,
Mhm.
the supportive units that are being proposed to be putting in, how would they differ from the SROs that are in there?
So they would involve on-site supportive services. There'd be social workers and ostensibly some nurse practitioners. And in addition to what the city would pay in rent to the landlord, who's also the social service provider, presumably, would collect a fee for each person that they're giving supportive services to.
So now the building is running without city support, right?
Correct.
It's just running, people are paying their
Yeah,
rent,
just-
living there for 100 years. Why do we want to support a change?
So I don't think we are supporting it.
Well,
The building
well,
is
the
not,
board, the committee
Yeah,
was feeling good about it, the way it was described to us.
Yeah.
Okay, and so I don't know if we had a resolution or
no, it was
it was a
tabled.
positive
yeah,
reaction.
yes.
Yeah, it was tabled and,
But it was tabled in a way that we were talking positive.
right,
Nothing we just talked about sounds
No.
like what we heard.
no, definitely not. And these are some new details that have come out since the West Side Rag wrote about this in late
Yeah.
February, and since members of the
Right.
community have reached out.
Who owns it?
Who owns it? I
Nuns.
believe it's the Sisters of
nuns.
Charity.
Yes, it does.
Yeah, so
Yeah.
they own the property and it's not rent stabilized. They could redevelop it as of right, as soon as
Market rate.
it's vacant. And that's from what I have heard, all the leases are set to expire by the end of October. So when we do have the joint meeting with Housing Land Use, which is a great suggestion. I think we'll bring in some guest speakers.
I think even
You need to bring someone from
Outrageous.
DHS, and you need to
Sure.
bring in,
There was somebody from the city, I thought, that was presenting this.
Yes, and it seems so innocuous. Sure, these elderly nuns will find another place for moving people who need housing. Terrific. But not, no, you know, if you took what was said then and what just the factually though,
Mhm.
it's like so contradictory and so, you know, so false, what
Yeah.
we heard.
When was that presentation?
About
Yes.
last
month.
month. last month.
Yeah.
But it's two distinct populations. The supportive housing is for formerly homeless who have issues that, like drug addiction or.
Right, that would be the
alcoholism.
new iteration.
That would be the
But
new
not
one.
right now.
So they're presumed, these are people who are much harder to house.
That's why they're
And
reducing
that's
the
why they
number.
need support.
Well, the other piece of it is that with, for example, when Project Find has been redeveloping, or even with Wishfish has. Many of the units are very small units without their own bathroom, without a kitchenette, so ideally, you want to have a permanent housing that has their own bathrooms, that has their own kitchenette.
Mhm.
So it requires, instead of a room this big, it
Right.
requires a room this big.
Right,
Yeah.
right.
So very often you have to take 150 rooms and reduce them maybe to 80,
Right.
but not necessarily 50. Not knowing the building, not seeing,
Mhm.
We don't even know that.
not seeing a plan for the building.
There are lots of outstanding questions.
Right.
No one has been in there, no one from the
No.
committee.
What?
I'd be glad to help work.
No.
Thank you, Roberta.
Maybe
I'm gonna
we-
take you up on
No, seriously.
Maybe we could take a tour.
Yeah.
Why, we've done
Seriously.
that before.
I mean,
Yeah, but
really,
And I
If they'll
will
let
say,
us.
not to disparage the Sisters of Charity, but I know the CEO, I've emailed with him, and it sounds like he is actively looking into this, and that he does not want anyone to be displaced by this redevelopment. So I think we do have a partner there. Maybe that's me just,
Yeah.
erring on the side of trust, but I think that they're being genuine.
And will they be the supportive service provider, the sisters?
Mhm.
I-
Sometimes they hire another firm.
Right. Yeah, they could subcontract out some of the supportive services.
It sounds like they're making a killing out of this. I'm sorry. They're reducing the number of people. They're
Reducing.
getting money from the city, which they haven't before. And they're,
It's a
what
lot
are
of
they
things
doing
to
for
look
the
at.
neighborhood?
Yeah.
Nothing.
What do you want them to do for the neighborhood?
I'd like them to have as many people in there as they used to.
Oh,
Well, but also they're providing supportive housing, so I mean, they are doing something, maybe not for the neighborhood, but for
So
society
they're
too.
They're
mean-
throwing out people who don't need supportive housing.
And ostensibly, they are
Their leases are
going,
up.
they are going to help people relocate. That's what I've
Yeah.
heard. The question is, will they actually stick to that?
Yeah.
I don't think they're gonna be located
Right.
on
And that's the
Seventy-fourth
other
Street.
problem, is that we lose
Yeah.
buildings
Where-
and then
Mhm.
those people
Right.
are.
They're no longer in our community.
And
They're no
those
longer part
people
of our-
were, many of them, a large number were a long time in the community,
Yeah.
and they would never be able to afford
Yeah.
anything in the
And
community.
people on this block are also irate because there was a shelter added, just a couple
Yeah,
doors.
But it's
down.
not a
The
shelter.
former-
This
The
is-
former Calhoun.
No, the
Calhoun.
shelter down the street.
Right down the street.
Right, so they
Oh,
feel,
no, I know.
the people on
They-
74th Street feel
They're,
overburdened.
they're putting them together and saying, look what's happening to our,
Exactly.
to our street.
But this has been there forever, so this is
Yeah.
nothing.
Exactly.
So this will be continued,
Yeah.
but certainly very important for us to keep an eye on.
Well,
So Mount Sinai is now considered out of network. I should have had a hyphenation between the out of network. But on March 4th, Mount Sinai and from Blue Cross Blue Shield, failed to reach an agreement and contract negotiation. And about 200,000 members, who do receive care in the Mount Sinai system, are now no longer covered,
now
unfortunately.
that's for Anthem for hospitalization.
I believe it's for outpatients.
Yeah.
As well.
For the whole thing.
Also-
Yeah, for the whole
That's what I
thing,
Also-
heard.
Whole thing.
for the whole thing. And there is this continuity of care provision. But I believe that that's all expiring
Yeah,
March
temporary.
31st.
Okay,
And last year, Mount Sinai and Humana couldn't come to terms. And because I knew of somebody who was on Humana, Medicare Advantage and had to switch.
Yeah.
Because,
So-
couldn't use. So,
And both sides blame each other.
Sure, and how many? Who does it, Mount Sinai actually consider in their network now?
And there's
Those
another problem.
Those
is
are
that
big entities that they're
Yeah.
getting rid of.
If you call
Aetna,
911
United, they
Mhm.
still
and they
have.
come, they take you to the closest hospital.
Yeah.
So
the closest trauma
Right.
hospital.
the
This
closest,
is emergency.
right, so if your insurance is not accepted at Mount Sinai, but it say it's accepted at
Anywhere else.
anywhere else,
Mhm.
and you fall on the street in the Mount Sinai catchment area, you're
Yeah,
you're stuck.
we're in the Mount Sinai catchment area. So anyone that's listening to this that has Anthem, should just be, cognizant.
Well,
If
don't
you're gonna
worry.
fall
When I
outside of our
fell-
district.
911, no one came. Okay, and the police came and they said, where's the ambulance? And they called, they said they have no ambulance. It was a Friday morning, they didn't have one.
Whoa,
Fortunately, and I'll share it with everyone, there's a Jewish community ambulance service,
Right.
Hatzolah.
Yeah.
Someone, I didn't have the number with me, someone gave it to me, and they came with a car in a minute and a half, and then by 2 minutes, there was the ambulance and 4 people to address the issue, and they'll take anybody who
Yeah.
calls.
and do they only go to the local hospital, or do they go?
They immediately come to the local hospital, depending on the situation. But if someone requests for some reason, like their doctor is there and I have this condition, they'll take them further.
Paxala is terrific, and as Shelley said, they'll take anyone. So it's
Yeah.
a good number to keep on hand.
Yeah.
I don't know it off the top of my head.
On Rosh Hashanah, Stanley Zaber fell outside my synagogue, and he needed to go, broke his hip, he needed to go to the hospital, his daughter's hip, and my hip. And we always have an ambulance nearby, but they were gonna take him, I guess, to Mount Sinai. So we had to call his grandson, who fortunately works at EMS, and the grandson was able to do whatever he needed to do, and he ended up at NYU with his daughter.
Mhm.
But had we not had
That connection.
a crew of people that could get into action, he would have ended up at Sinai.
Absolutely. I feel like this is also a decent opportunity to very quickly, before we go into Michael's presentation, just mention the NYC Care Program. New York City Health and Hospitals has not an insurance plan, but they do have a plan that provides unrestricted access to the New York City Health and Hospitals network, both inpatient and outpatient.
Yeah, pharmacy.
And pharmacy.
Yeah.
For sometimes no deductible, sometimes a very small deductible, no monthly premiums. It's a terrific program. It's called NYC Care, and maybe we'll have someone present on it at some point.
How do you qualify for it?
By income.
Uh,
Yep. And I think you have to go to a Health and Hospitals enrollment site, that they designate on the internet. Michael, are you ready to jump into your
Sure.
presentation? Okay, and you can just let me know when to
Awesome.
move ahead.
Okay. So, Isaac asked me to talk about measles and bird flu and what's happening in New York, and I add a little context for national occurrences too. So, the next slide, that's the measles rash. I've never seen measles rash before in this patients. Unfortunately, now though, more people are starting to see them. Measles is very contagious. It's actually one of the most contagious diseases. If you just go into a room where somebody had measles or has measles and they had been in that same room, you have a high chance of getting it. And if you're unvaccinated, and if you're just next to them, you have a 90% chance of getting it. Again, if you're unvaccinated. It starts off with flu-like symptoms, then you get that rash. It starts from the hairline and goes down. Again, it's very contagious. You can get a really high fever, and it can have very serious complications, including pneumonia, brain swelling, encephalitis, and pregnancy complications. And unfortunately, a lot of people that get it are infants just because they haven't been vaccinated yet. There was a big outbreak here in about 7 to 8 years ago. This was just one infant came back from Israel, hadn't been vaccinated, got exposed, and you can see what happened. 81% of the people were under 18, but 40% of the people who were hospitalized went into the ICU. So that's whatever 8% of 649 is. So it's a pretty high amount. So far this year, not a ton in New York. There's only been 3 in New York City. They all were traced back to international travel. One was an infant again, and in the state, there's only been 7. So we're not doing too badly. And on the right is all the cases there. This was just a map of coverage. We actually do pretty well. Most of the places are over 80% And you can see kind of some of the places where it's a little bit lower there, the lighter is lower. Staten Island's not doing great, but most other places are. And then New York State is interesting. They keep separate, New York State Department of Health and the state are separate entities. So this is the state map. And you can see those two counties. I don't know why they happen to have such low rates. I forget what the names of the counties were, but they're, you know, the one up on the Canadian border, I don't know if, I think that might be where Rochester is, but I might be totally wrong with my geography. And I don't know about the one in the center of the state too. And again, this is what happened in recently. It's just that was on just what I talked about, like the cases that were linked to international travel. And this is what's happening in the United States. A huge amount, if you think about it relatively to what it was probably even 10 years ago. Most of the cases are not isolated, they're associated with outbreaks. Most people who get them are unvaccinated, or we don't know if they've been vaccinated. And luckily, no deaths so far, but 5% of them have been hospitalized, and 3 people died from it in 2025, and we're early in the year, so we don't know about 2026. And these are where the outbreaks are. If you've been following the news, you kind of know the one in Texas and South Carolina are the biggest. And now it's happening in Florida and Utah. And there's, you know, both cultural and medical reasons for those outbreaks. And then this is our vaccination rates. So again, not surprisingly, I mean, Texas a little surprisingly, but not surprisingly, like the lower vaccination rates are where the outbreaks are happening. Although South Carolina and Texas have pretty good vaccination rates. So, and New York has excellent overall vaccination rates also. And then this is just how it's been going. Like I said before, you know, 2000, whatever, early 2000s, they were barely in the United States. This is from the CDC. And now we're going up to almost 2000. And so there's no treatment specifically for it. You can get immunoglobulin, which are antibodies to measles. If you're diagnosed with it and you realize but normally get diagnosed pretty late in the disease because the rash comes out. We need about 95% vaccination for herd immunity. So we have that in New York, but a lot of places don't anymore. And the vaccine is highly effective, particularly if you have, you know, if you're up to date with your vaccine, gotten the booster.
When do people need to get the booster?
It really varies. Like sometimes I think generally like teenagers get it, but adults very rarely do need it. We don't check for routinely. We just check for like most people we check for, it's because for employment, they need to prove immunity, and most people are still immune. So there's no like definitive time where you would need it as an
You
adult.
mean check through a blood test or?
Yeah, exactly. Checking a blood test to see if you have the antibodies at the right titers, if you're still immune to it. So that's measles. Bird flu is luckily not very relevant anymore. Very low public health risk. There's been no known person-to-person spread. 71 cases and 2 deaths. They're all related to, with people who work with animals, basically. And you can see on the left there, dairy herds, poultry farms, other animals, and where they've been geographically. New York had a few cases of it, but sorry, not New York, not people. These are actually dairy herds affected by it. And you can see they've been mainly on the west, so they haven't really gotten over to the East Coast yet, and no human cases in New York State yet. And same, symptoms can be very variable. Some people get mild symptoms, some people go to the ICU. Luckily, the bird flu, that was one of the risks, is that it can mutate and then it can become contagious to humans. Luckily, that hasn't happened yet. And if you do get bird flu, they're actually susceptible to their like Tamiflu and those other antivirals for flu. And again, if you're not a dairy farmer or working with chickens, it's very unlikely you're going to get bird flu. So luckily, not a big public health problem.
Thank you for that, Michael. And
Yeah.
and I will say that there has been an uptick in bird flu cases amongst wild birds here in New York City. There have been reports of some flocks of birds just being found dead in Central Park. But it's reassuring to hear from Michael, there is no animal to human transmission, and that there is no human to human transition that's ever documented. But nonetheless, if you come across a dead bird, call 311, like don't touch it and, like put it in your mouth and stuff, like call 311. They'll probably redirect you to actually an organization that's right here on the Upper West Side, the Urban Wildlife Sanctuary. I emailed with them earlier this week, asked if they could present, but they weren't.
Right next
And
to
don't
the
let your
Gale's
dog.
office.
Exactly.
Don't let your dog near it.
But
Yeah.
don't call 911 because no one will come.
Oh, it's, uh,
But yeah,
if it's-
so call 311. Don't pick it up.
Yeah.
Don't bring it to Gail Brewer's office, even though that's where the bird will it'll
Mm.
probably end up going next door to hers, because that's where the urban wildlife sanctuary is. But thank you, Michael. Any questions for Michael? Are we going to the next
Thank you.
slides?
Yeah.
Thank you, Michael.
Yeah, so in New York State or New York City, has there been a large or perceptible decline in the number or percentage of people that are getting vaccines for measles?
Yeah, the rate, I mean, overall, if you look at overall, it's not that low, but there are certain pockets in the city, like that map that I've shown before is kind of
In
showing
the
that,
city?
yeah.
So I think back at the time that there was an outbreak, it was the Hasidic community
Yeah.
in Brooklyn.
But you're still required to get shots to enter public school.
Yeah, those, right,
But they
that's
don't go
true.
to public school.
I know that, but
Yeah.
at least,
I mean, that's where that community was the one, that's where the outbreak was also, so. Yes, but if you look at the map, there was like Staten Island had but they're also like relatively low rates, so instead of 95, they're 90%, you know, they're not like 20%, like,
Right.
or 50% like those counties in the middle of the state, so. It's, but I think overall in the city, the rates are still relatively high, or high enough.
Yeah. Okay, thank you.
Perfect. Thank you, Michael. So I'm gonna give a brief presentation on the entry into and exit out of the New York City shelter system. We had budgeted about 20 minutes for this, but I'm gonna try to speed through it. And if there are any questions, feel free to stop me. So New York City is very unique in that it is the only major city in the United States that provides the legal right to shelter for anyone that needs it. This comes from a 1979 lawsuit called Callahan v. Carey, which grounded, which said that the right to shelter is implied in the New York State Constitution, which states that the aid, care, and support of the needy are public concerns and shall be provided by the state. So the case was settled in 1981, the lawsuit again started in 79, but from 81 onwards, New York City has had the legal right to shelter. And that has since been extended to women and to families. And there is no residency, income, or citizenship requirement. Anyone without a place to stay qualifies for the right to shelter. So the process to getting into shelter is pretty straightforward, although it is very, very cumbersome. One could call 311 or visit New York City, the accessnysc.gov website to get information about what shelter options are near them and get directions to one of the so-called intake shelters. There are different intake centers for different populations, and we'll go into each of those. But all of the intake centers are open 24 hours a day, 7 days a week, including on weekends and holidays. So what happens is you go to one of these intake centers, you request shelter, and the workers there will ask you if you have any other viable, safe, or non-shelter type setting that you could stay at, whether that may be with a friend, with a family, whether that person be in New York City or out of New York City. And if it is determined that you have no other place to go, you will then be connected with a shelter. Department of Homeless Services will assign you one through what they call the Joint Command Center, JCC. Documents are helpful, but they're not required. And here's a list of the intake shelters. So there's just one in all of New York City for single adult men, regardless of if you're in Manhattan or Staten Island or the Bronx. You can only go to 30th Street, which we discussed earlier this meeting is relocating. 30th Street obviously is not relocating, but the men's intake shelter, which is currently based at 30th Street, is relocating to the Bowery on May 1st. But regardless of where you are in the 5 boroughs, this is the place that you need to go to request shelter if you are a single adult man. Unless an outreach team connects with you on the street and then connects you directly to shelter. For single adult women, there are 2 options. There's one in the Bronx called the Franklin Women's Shelter, And there is one in Brooklyn called the Help Women Shelter. And for adult families with no children under the age of 21, currently go to 30th Street, same exact location that single adult men currently go through intake. But again, on May 1st, that is going to be relocated to the Bowery. And then for families with children and pregnant women, there is the Prevention Assistance and Temporary Housing Center, also known as PATH, and that's located in the Bronx. And that is where Department of Homeless Services will connect any families or children or pregnant women with shelter. There are also some drop-in options. So these aren't shelters, but these are spaces that people experiencing homelessness could access hot meals, showers, laundry in some cases, and even case management. And there are 4 drop-in centers in in Manhattan at the moment. There are several others throughout the boroughs, but in Manhattan, there are just 4. And most of them are in the Chelsea, Midtown East area, or stretch from Chelsea to Midtown East. The one that's closest to us is on 9th Avenue between 51st Street and 52nd Street. And that, I believe, is run by Urban Pathways, though I may be mistaken. But anyways, these facilities are open 24/7, and people could go there to access those services. If they want to sleep, they could sleep in a chair, but again, it is not shelter. Did you have a question?
No, I was just gonna ask what you just.
So here are some of the differences between shelters and some terminology that we often hear. So the word shelter is typically referred to in New York City, is typically referred to a large congregate facility where you may have dozens of people in one room, sometimes even hundreds. It's really the traditional barrack style shelters that you have in mind when you hear that word. And the city is increasingly moving away from that model towards something called the safe haven model, which is a low barrier space for people that typically have experienced street homelessness, and there are no curfews associated. The facilities are open 24/7, and there is intensive on-site supportive services. So this is really effective for people that have serious behavioral health needs, and of course, a much better alternative to the large congregate setting. There's also the stabilization bed model, which is very similar in its requirements to the safe haven model, in that it's very low barrier. There's no requirement for sobriety. There are no curfews, but there are fewer supportive services on site. It's really intended to provide an immediate exit for someone to get off the street. And then there's medical respite, which is where people experiencing homelessness could be discharged from the hospital into. So if someone has a serious surgery, you don't want to just put them in one of these congregate shelters. You want to put them in a place where there's skilled nursing on site and where there's proper support. And that's what medical respite is for. And unfortunately, there's a real dearth of that in our city, but hopefully that'll change. Here are some pathways to permanent housing, and I'll share, I had this graph made with the help of Perplexity, which is a great AI tool. Input all the data, of course, but it made this very nice graphic. So you see on top all the options that a person could receive help from if they're experiencing homelessness. You see that they're connected then in one way or another to case management. And down below, we have the different pathways for them to enter into permanent housing. So there is the city FEPS voucher, which Roberta mentioned earlier, which is the city's version of Section 8. The city will pay a person's rent, and in some cases, a household receiving that voucher may have to pay up to 30% of the rent. Recertification is due every 5 years for that. So once a person gets the city PEPS voucher, they're good for 5 years. Then there's rapid rehousing, which is households that are independent. They're in a temporary cash flow crunch, but they do still have some income. And it helps people with moving costs, perhaps some like rental arrears over time. And it's normally very time limited. It's only for a couple of months that rapid rehousing will be active. Then there's the 2010E supportive housing route. And what that is the pathway that the people entering into the proposed St. Agnes site would be entering from. So these are for the 2010E route is for people with serious mental health, medical, or substance use needs. And what's involved is a caseworker working very intensively with one of those people to submit what is called the 2010E. And some things that are involved in the 2010E are a comprehensive housing history, a comprehensive biopsychosocial, a psychiatric evaluation performed by a licensed clinician, and there are unfortunately a real dearth of supported housing units in our city as well. And then the last option is family or friend reunification. So if someone has a friend or a family member that they have identified that they could live with, the city in some cases through their pathway home program will actually pay for a person to move down there. And in some cases, they may actually pay whichever friend or family is bringing in that individual, they may pay them some sort of stipend or some sort of rent payment. And then the last option that isn't listed here is, of course, someone just getting back on their feet, working, building up some savings, and then renting an apartment on their own with no subsidy.
Isaac, what's the rent cap?
The rent cap, yes. So there are different rent caps for city FEPs. Those are published on the HRA website. I believe for a studio and for a 1-bedroom, it's about 2,400 a month. And there's some debate, obviously, amongst economists, whether that distorts the market, because then you have landlords that feel they can upcharge the city. The 2010E supported housing, the tenant doesn't have to pay any rent. The city pays all of that. But yeah, for FEPs, it's about 2,400 for a studio or 1-bedroom.
And who pays that in for FEPS?
For FEPs, that's us, the New York City taxpayer.
The client also pays 30% on that.
Right.
Yes, in many cases, they do. In many cases, they do. And City FEPs is a deeply flawed program. There are lots of hoops that landlords have to jump through and that prospective tenants have to jump through to get their apartments approved by DHS.
There are any statistics about what percentage of people make it out of this horrible system?
So there are, and most people do make it out, but it takes a long time.
But the greatest number,
Mhm.
percentage wise, is from safe havens,
Yes,
okay? We had one on 105th Street for many years, was like 93% in a year
They go to apartments.
go to permanent housing. That
Oh.
was extraordinary, but it's safe haven. So when I advocated for safe haven, people going crazy here, it was the gold standard. By the way, the funny thing that happened is the 3 people who were most vigilant about it's not going to happen half year after called and said, when is it opening? I said it opened a half a year ago.
Mhm.
They, why didn't things happen? I said, mean problems?
Shelley, but the Westfish shelter that used to be on 180, where
It's-
does that fit into all this?
It's, well, it's a transitional shelter. Most people, just about all of our people end up in permanent housing if they remain at Valley Lodge. We don't call it a shelter,
No,
it's Valley Lodge. It has the supportive services. It, brings people back to where they needed to be or better. In fact, one of our graduates, and we have a graduation and we have alumni. One of our graduates became a commissioner in New York City.
Recently, yeah.
Yeah, you know, it has a good thing, but we never called it a shelter. Call it Valley Lodge. It's a place to come home to while you need a home until you're ready to go on, and
And
that's
people
the
have their
path.
own, they have their own right, their own apartment, their own space.
It's the people who came in from the street. There were street homeless that came in there.
Yes. But well, at one point, it was very flexible. If we had someone to bring them over, they do the intake, and most of the time, if there was space at that time, they came in. But now they have to go to a shelter for at least 3 days or more, and then they're sent by DHS if Valley Lodge requests them, for the most part. So I was trying to figure out why would that have to happen? And the other thing, maybe I'm just cynical. Then the city can say, we placed someone, okay? Because they were in a shelter and now they're in Valley Lodge. Otherwise, we were doing it fine. We also, with many of our buildings, except for those that were on, on lists from HUD, if we had space, we were able to take people in from the community based on need. Today, it's very unusual. But right now, there's an open window because there are spaces that need to be filled. And we don't have to go through, the system. So we're so excited,
That's my
because-
original question. Where, is that considered a safe haven?
No, it's not a safe haven. It's
And it's
safe,
not a shelter?
and it's not a shelter. It's something in between.
Maybe a stabilization bed,
What's that?
stabilization bed.
That's really, yeah, I
Yeah.
think that's probably the best.
So other than the shelters, which are congregate facilities, the other options are 1 and 2 people to a room.
Well, that's a great question you ask. Many of I'm gonna call them shelters, although they don't fall into that category in the top row. Many of the shelters, although they're classified as safe havens, may have 20 people in a room. And I've seen this with my own 2 eyes.
I own 2.
Well,
Yeah.
locally, it's been 1, 2, 3, or possibly 4.
Yeah,
to a room.
There,
But
oh, sorry.
yeah, so, and community board people were really concerned about the 4 in the room and so on.
Right.
And it was a real concern, but, people who realized that they could have this situation where they didn't have to go through the whole rigmarole, okay, that they could choose the services that they wanted to receive, that they could come and go, although there was, they were monitored, took advantage of it. And when, I'll never forget, during COVID, there was, fell on the street between 92nd and Raphael, between 92nd, 93rd. And first he wouldn't speak to anybody, and over time, maybe over 3 months, I said hi, he said hi, we got to talk. When I mentioned Safe Haven, this is before we had this one, the one on 83rd Street, he lit up. And I've seen that with other people, they know what that
They know
is,
what-
they know that's up here, and that's the best alternative.
And there's another terrific safe haven that just opened here in Community Board 7 called the Monument, which is run by Dr. Riverside. It's in 95th between Riverside and West End. And it's all single and double rooms. We actually just placed someone there from my agency. But one of the criticisms, I think, of the system, which Shelley mentioned, is that the Department of Homeless Services has very centralized control over all of this.
Yeah.
A person may request, a street outreach team may engage someone here on the Upper West Side. That outreach team may then reach out to the Joint Command Center, JCC, which decides where that person gets placed. And that person will be offered a placement, let's just say in Staten Island. I haven't heard of any placements in Staten Island, but it's
Well-
plausible. No way would the person want to go there. No way, they want to stay here on the Upper West Side. So I think bringing it back to the resolution we passed a while ago about creating very hyper-local, like faith-based shelters. That could be a very viable solution for getting people in CB7 off the streets.
Has the city articulated any reason for their intransigence?
With JCC,
Not with the being in control about where people go and not allowing.
I'll find out on April 22nd when I meet with the deputy mayor.
Prior to
Maybe.
Prior to COVID, we had a shelter on the other Sixth Street. That was a women's shelter,
Yeah.
and the community had really reached out and really supported.
There's 107.
Is that
And the
there anymore?
community had really reached out and supported it. The local church had events there for the women. There were local restaurants that would give them free food. And the city, in its infinite bureaucracy, decided that it was easier to move the women out. And because the women were so easy, and they moved them in. And there was stuff was going on that was absolutely crazy, and the community was up in arms because they really wanted to keep the women. They weren't against having.
And they
usually-
say 10 years, 12 years before, they didn't want a women's shelter there.
Right,
But over the years,
they come to
they
really,
became integrated. Many had jobs in the community. And when they sent them out sometimes to Far Rockaway and to other far places where they had no roots and no connection. And their jobs were closer to where they were before. So, we had demonstrations there. It was terrible. But they prevailed, the city prevailed, and then they were men in.
Shelley, that is an excellent segue for the next part of the agenda.
Okay,
We didn't plan this by any means.
we're just attuned.
Exactly, we're on the same bandwidth. So there's no resolution in front of everyone today. I just want to discuss it. And Ken and I have consulted over email, Ken being the chair of the co-chair of the Transportation Committee. The MTA is deeply inaccessible to people experiencing homelessness. Fares are now $3 a piece. If you don't have an Omni card, you can't go to job interviews, you can't make work on time, like Shelley said. You may miss appointments with doctors and with social workers and case managers. You may be compelled to hop a turnstile, although that's becoming a lot more difficult in
it's
many
very
stations.
difficult.
And of course, that's precarious because people can be arrested. Anyways, shelters, like Shelley said, are often very far away from the sources of life that our neighbors in the shelters have. They're away from jobs, they're away from healthcare facilities, away from social workers, friends and families, schools. I'm glad you mentioned that, Mitch. And the only program that is currently offered for accessible transportation is the half fare program, fair fares program. And even so, if you have zero income, half a fare is not gonna do anything. Divide zero by anything, it's still zero. So anyways, what I would love for us to discuss briefly, and I want to be conscious of the time also. And I know that Hayden had a presentation on air pollution. I want to just talk through potentially drafting a resolution that would support free Omni cards for people in the shelter system. There is precedent for this. I mean, during the pandemic, the city did this for essential workers and other vulnerable, and for vulnerable populations. And we do this for students currently. Students get the free, unlimited Omni cards. They get
I
up
have
to
one
4
right
rides a
here.
day. You have one right there. Amazing.
Okay.
I think we should issue the same thing for people that are living in shelters. So anyways, with that said, I want to just open it up for any comments,
Have
suggestions.
other
So moved.
organizations that work with,
Yeah. So moved, just.
have other organizations that work with, homeless have asked for this.
Not that I'm aware of. My agency used to provide Metro cards to people. Since those have been phased out, we've been in limbo on how to get people Omni cards. And as far as I'm aware, lots of agencies are frustrated with the transition.
Because you can no longer give out the Metro.
Exactly. There's a special Omni provider portal, which one could apply for to purchase cards in bulk. And my agency is still in the process of getting its application approved. But even so, it's a considerable amount of money for community-based organizations to dish out for Metro cards or Omni cards.
My suggestion is that we should have a resolution, but before we do, we should know how it could work,
Mhm.
so we can, we should talk to someone at Omni.
Mhm.
I have somebody's, can send that to you,
Amazing.
So the mayor,
so we can find out exactly how it would work, so that we're not just saying it's a good thing, we can say
Right.
it should be done X, Y, and
Mhm.
this way.
Someone to distribute cards and. be a
How you would
gatekeeper.
get it.
Yeah.
so when the mayor campaigned, he seemed like he was open to this. He's
Mhm.
free buses for everyone, so it would seem that this is an hour or group of people and he should be supporting.
Yeah.
So who will we get in touch with?
Because, I mean, not everyone needs the free bus fare,
Right,
but they're gonna be given it, whether they need it or not.
Mhm.
These are people who need it.
right.
So how do we get it focused on
But
them rather
not
than on
necessarily
food
buses.
for everyone?
Exactly. And there's precedent through a city administered program.
So I would suggest bringing this up at the April meeting.
Absolutely.
Let's do some
what
research
meeting?
between now and then. I bring this
Next
up at the
meeting.
April meeting and do a little research so we can have a well thought out
Yeah.
resolution.
Is this another transportation, meeting, meeting with them too? I mean,
Well,
it
it
seems,
should be, you should invite transportation, it should be joint meeting.
Yeah.
But we would come here.
Mhm.
We would wanna know how much it might cost.
Mhm.
Did you get a chance to talk to Andrew before he left the board?
Andrew.
Andrew Albert?
We emailed a little, because he's on the MTA's advisory board, right?
He's on the board, he's a non-voting member of
Mhm.
the board. Did he have any comments?
He was looking into it.
Oh, yeah?
Yeah.
Well, you should get, if you need his email, we can
Mhm.
get it to you.
Thank you. I'm gonna take you up on that. All right, well, we've gotten this on the radar, which I think is great. And I guess in April, we could wordsmith a resolution together, we could come with some draft language, and then we could pick it apart amongst the committee.
Someone said about how much it's gonna cost, so it just occurred to me, if the mayor was advocating for everybody to have
700 million.
free bus, that was 700 million
Mhm.
for anybody to take. So this is a smaller subset.
Mhm.
So I guess we need some economists or some person
sure.
good with,
Because it's bus and subway.
right, but it's a smaller.
We
I
just
know.
have to know
How
how
much
many
a card
people in
is.
shelters.
yeah, there's 140,000.
And what percentage that is of the population.
And how many trips
that's
per year?
Or well, it's an unlimited metro, there must be a charge for an unlimited
Mhm.
Metro card, so
Well-
there's gotta be a price that they give, like whatever they're
Mhm.
charging the students or the schools or, whatever that.
They can set the cards up to do all kinds of things. So it could be 4 trips, it could be 6 trips, it could be 1 trip every week.
Yeah, that's. We should just do unlimited, I mean, what's
Yeah.
the point of?
Totally.
Yeah.
I think this could be a really
It's good.
great opportunity,
That's
and for the community board also to be at the forefront of.
You know, I think this is a good idea.
And maybe show some kind of comparison to fares
Mhm.
and how much that's
Right.
costing.
Good idea.
Absolutely. And it would actually save the city money, I think, is the argument, because people would then be able to go to housing interviews, to go to job interviews, and slowly but
Mhm.
surely get back on their feet.
And they wouldn't be in the carceral system.
Exactly.
For
If
jumping.
they're, yeah.
Exactly. So to
And
be
especially if
continued.
they're paying 81,000, what is it, it's 81,000 a year?
Yeah.
Yeah.
I mean, that's a
Yeah,
pretty easy cost
Right,
benefit
right.
to
I
get
wanted to
people
ask-
out of the system.
I wanted to ask you about that. Where does that $81,000 a person go? What are they spending it on?
So,
Services.
yeah, it's going to the outreach
People.
workers, the agencies and their administrative overhead.
And the rent,
And the buildings.
Yeah,
the rent, and then
I thought
all
they're
the
homeless.
services.
No, the shelter.
well, these are the services provided to people that are on the street.
Yeah,
So the vehicles and the workers and the administration
It's just
actually
that-
does the work.
yeah, but they're not, the people on the
Correct.
street are not getting any of
No.
that.
Correct.
It's not getting them into a shelter. It's not
Correct.
paying anything.
Well, but
for
they're
anything.
giving services, so that they, well, would not otherwise be getting.
Like what?
Ostensibly.
If it
People that are
was-
resistant to going into shelters, they're being met on the street.
Yeah, but you're saying it, Roberta said they're getting services, but it doesn't seem to me like they're getting any services.
Not
The outreach
necessary.
teams work very hard.
Oh, I'm not saying the
Yeah.
hours, I'm saying that they're rejecting everything. They don't want it, they won't take it, so.
Mhm. Yeah, no, it's a valid criticism. Definitely is. Yeah. Wow, well, this was a very rich conversation.
I want to hear about the environment.
Yeah, absolutely.
Oh, I think we should move that till next time, I'm
I
sorry.
think so.
Okay.
Should we start with it next
That
time?
would be fine, that would be.
Yeah, the air's not getting any better.
Well,
Yeah,
you know,
Michael.
surprisingly, it is getting better
Okay.
in many of our boroughs, not in the Bronx. But that's one of the things I want to have an update on. The city's data has changed since
Yeah, that's because the Bronx insists on being attached to land.
well, I think it's more of the legacy of.
I know.
Cars that go through the Cross Bronx Expressway.
That's.
Which destroyed my candy store and we had to move
Adjourn.
because of the.
What was their new business? I don't
Yeah,
know.
any new business or comments from, hey,
Sounds like. there's some-
you.
I've got one. I know you, I think I've met basically everybody, but just in case I haven't, hey, I'm Q from Eric Botcher's office, your new state senator, so first off, you need anything state senate wise,
Okay,
talk to me. Also, from the Upper West Side, live all of 7 blocks away, so,
that's terrific.
you know, you guys also literally represent me, so thank you guys. Wanted to come in just in general, like, good to come in, pay attention to what's going on, and also let you know, we have, in the vein of public health, do you guys remember these posters? Were these up here? Yes. So these are from the city, not the state, but when we transitioned out of council, we ended up with a big stack of these, and I'm going around popping them at everybody. Because I'm not throwing them out, I absolutely refuse to, because the moment I do, we're gonna get emails saying, hey, what about this poster? So. If you or anybody you know, you think would want a poster like this outside of their building, outside of their shop, yes, take them. We were, just one, take it, no, you're good, yeah, $90 each, you can find me on Venmo.
Thank you.
No, of course it is, yes, they're completely free.
I can take one for my school.
Please do it. You want the restaurant one, or do you want the?
What's it say?
I'd take
It says feed a pigeon, feed a rat.
Maybe that's
Can I
a
move
community
to
board one.
Sure, any other
Yeah,
comments?
word,
Anyone
feed a
wanna
rat.
add anything?
No,
Okay,
you're good.
so motion to adjourn?
So moved.
All right, thank you, everyone.
Thank you so much.
Great, great meeting.
Roger, and-